Welcome to Conversations with Kay. I'm Kay Ryder, and every week I talk with Vermonters who are leaders in the fields of government, healthcare, education, the arts, and community life. My guest is Representative Ann Pugh. Ann is the chair of the Vermont House Human Services Committee. Welcome back.
Well, thank you, Kay. Thank you for inviting me back.
Always glad to have people in during an election year. Now, why are you running for re-election, Ann?
I'm running to bring leadership and experience to the legislature at a time when there is going to be big changes in the governor's office, in the lieutenant governor's office, and in the leadership of the House and the Senate. I'm running to continue to represent South Burlington and to represent the things that are important to South Burlington in terms of moving the state forward and ensuring that this is still a wonderful place.
Great. Now, do you have someone running against you?
I do. And I love the fact that I have someone running against me because it means there is a choice. And it means that the people in South Burlington get to really look at who is out there.
Right. Is it hard to raise money now for re-elections?
Raising money is, unfortunately, I would say a necessary evil at this point in time. There are 20 Vermont House members, of which I am one, that the Koch brothers and the National Republican Leadership Committee have decided that they'd like to see not return, and so they have put a lot of money into the campaigns. It doesn't seem to be something that has been a real impact in my race and in South Burlington.
Well, in some ways, in my opinion, having the Koch brothers against you is probably a good thing, but that's my opinion. How long have you been chair of the Vermont Human Services Committee, Ann?
Well, I want to thank, I think it's been over 10 years. Speaker Gay Symington, when she became speaker, appointed me as chair, and she reappointed me every year, and then when Shap Smith became speaker, he kept me on.
Ah, well, that's good names there, good names. How many representatives are on the Human Services Committee, and where do they come from?
Oh, I love my committee. There are, counting me, there are 11 people, and we range politically from a progressive to a Republican / libertarian, maybe. The vice chair is a progressive. The ranking member is a Republican. And we work really well together, and I'm very proud of the fact that over 2 years of this particular makeup of the committee, there were only 2 pieces of legislation that came out of our committee that were where the vote turned out to be partisan. And one was an issue of social and what some might call value or moral. It had to do with end-of-life choices. And I think that was less partisan and more reflecting the personal views of people. And the other had to do with raising the age of when you could legally buy tobacco. But other than that, every single solitary bill that came out of my committee had was not necessarily unanimous. I'm not going to say it was unanimous,
right,
but had at minimum 2, if not 3, members of the minority party who voted for it and who would report it on the floor of the House.
Well, I think that's very good. That says to me that the Vermont committee system is quite democratic. And speaking about democratic, I mean the Democratic Party is all powerful in Vermont now. You have the governor, you have the House, and you have the Senate. And the fact that the committees do this says to me that everybody has a chance to say what they want to say and you know, talk about everything.
They do. I mean, and I can speak very clearly and maybe passionately about the committee that I chair, in the sense that we work really hard to make sure that everyone's perspective is heard. If someone has an individual that they want to have come testify, they do. We work together as much as possible in terms of identifying what is going to be our agenda for the year, what bills we're going to take up, and we sort of very systematically we ranked them, and when we couldn't get to the bottom one because we didn't have time, we knew that it was because we as a committee had had ranked them.
That's very important because particularly in human services, I think that people want to feel that, discussion is going on and the best decision that can be made by the committee is being done. And I like this idea of prioritization. I think that even in healthcare, even in human services, this can work. It's a good process.
Well, and Kay, I would be remiss if I did not mention the fact that through a national group called National Institute for Civil Discourse, they came and did a training in the legislature, and many of the committee members went, and it really was a focus on how do you talk, and how do you listen, and how do you talk cross-party, and along with two other people, or actually one other person in the Vermont House, we've been trained as trainers to go to and do workshops at other legislative bodies, because really we're talking about people, and other legislators are people, and let's work together because we all do have the same goal. We want Vermont to be the best place possible.
With the present political climate in the state, or not in the state, but in the nation, I think that's a wonderful process, and I wish that more of it was going on. I really do. And congratulations on doing that.
Thank you.
Now, the Shumlin administration has spent millions of dollars trying to set up Vermont's Health Connect and all this healthcare system. Do you feel the money was spent wisely? A consultant came in, was paid, and was asked to leave. What do you think about that?
I was brought up in my social work career says always start with the positive. And I think we have a lot to be proud of in terms of Vermont's, the percentage of Vermonters who have access to health insurance. We are and have been one of the top 2 states, and I think it's over 97% of Vermonters. And that is something to be really proud of. How we spent the money, the rollout of Vermont Health Connect was, I don't think anyone would argue, a mess.
Yeah.
That said, we've moved, people are moving and trying to move forward and make it work better, and
yeah, I think the time comes when you look at something and you say, boy, this, like you said, this has been a mess. Now we're going to go forward and see what we can do to make things better. And rather than wallowing in the past, just kind of say, okay, big problem. Okay, let's go on.
And it was a big problem, and the administration made some positive changes, and then over the summer, especially for a multitude of reasons, there became a backlog again, and issues again, and they believe that now, because now is the time, actually I should be saying that, now is the time to re-look at and to re-enroll between November 1st, to start looking at that.
Right, right. Where would someone go to do that?
They would, well, I would probably send them to the Blue Mall and to the Blue Cross Blue Shield place, but you can, they have a health plan. You can go online.
Right, right, okay. And it's important that people do that.
People need to do that because you don't want to be, miss the time frame.
Right, okay. Now, Governor Shumlin right now, very late in his term, is actually pitching a new model for paying Vermont healthcare providers, like doctors, called the all-payer model. Mm-hmm. This model provides actually a paid set amount to a doctor mm-hmm. for taking care of someone, rather than the doctor being paid fees for different services. Do you support this kind of model?
I certainly believe that we need to move away from paying for services, but rather paying for outcomes, because the way we have been, and this is, and so I support that concept of looking at how we are paying. We shouldn't pay for how many tests I get, because that might lead some people to have lots of tests, kind of thing, but rather, am I healthy? And perhaps encouraging me to do things so that I would stay healthy, that kind of thing. The all-payer waiver is a negotiated instrument with the federal government, and the administration has been in negotiations for a while. What has come out now is a draft agreement that the administration is, as we speak right now in middle October, they've had 2 public hearings, and they'll be having 2 more. From my perspective, it's moving a bit too quickly. That said, I think there may be some time frames that I'm not aware of that the federal government is putting in. This is not something that the legislature has, right where the process is now is this is an agreement between the administration and the federal government, and a new administration could change that agreement. But
right now, that said, probably with the summer and the leaves and all these things going on and school starting, if there were public forums, I don't think probably there have been enough of them so Vermonters have caught on what this is all about. That's just my own feeling. And you're saying going too fast, and I think probably that's true.
I mean, I think if nothing else, it's one of the things I've learned as a committee chair, which is sometimes you need to take a step back and go a bit slower, even if you think you have the right answer or the right way to go, but in fact to involve all of the stakeholders. And I mean, I think to be fair, the administration would say, we've been going down this road for a year or so, and many of the hospitals are involved. That said, we are doing a lot, and it's a little unclear how all of the pieces, it is unclear to me and to many of the provider groups, the community mental health centers, the health clinics, and the Area Agency on Aging, where they fit into some of these. Yeah. And at the same time that we're doing this, the administration is also engaged in looking at Medicaid and a Medicaid pathway, Medicaid being the public, the federal and state joint venture in terms of how we pay for services. And it's not just healthcare. We have a global commitment waiver, which enables us to, the state, to use to consider health a public health, and so to be able to use this mixture of federal and state dollars to support those programs and services and interventions that will prevent people from getting unhealthy, or what in the lingo is called the social determinants of health.
There we go. There we go.
Addressing issues like poverty, addressing issues like substance abuse, or or affordable housing, or long-term care, the supports. Right. So we've been,
Well, healthcare, if nothing else, is very, very complicated.
It is.
And when you try to go at it, as you say, having worked at the Visiting Nurse Association, I know that when you're taking care of someone at home, it's very, very different. Taking care of someone in the home, it's someone in the hospital. And when someone goes home from the hospital, if they have to go up 30 steps or something, that might not be the greatest thing in the world. You need to consider all these things, and is there somebody going to be there with this person?
Right. Vermont, I think we have something to be proud of in terms of what is called Choices for Care, but it is an option for those senior citizens who meet both income, so Medicaid, as well as sort of health and other criteria, to choose where they live, whether it is in a nursing home or an assisted living facility, or whether to age in place or to age at home. And between Choices for Care and then between the SASH, Services and Supports at Home, those two sort of models and way of assisting our growing older population in being able to remain where they have family and community as long as they are able to.
Well, I applaud all. I'm sure your committee over the years has done a lot for that, and again, it's very, very hard to work in all this, and you just have to keep chugging along. Now, as I understand it, this new all-payer model is voluntary.
Yes.
So that makes it even more important that people learn about it and what it is. And
well, it's voluntary for the physicians.
Yeah.
To choose to join or not. If I, as a patient, if my physician chooses to become affiliated with the ACO, but I don't want to, I need to go to a different physician.
Right, right.
So that's where the sort of,
Yep.
But there remain a lot of questions, and
it's sort of like the concierge system in a way. A doctor asks someone for a fee, but in this case, he's getting it from the government, and the government is going to pay him to give a certain amount of care. Now, my son works at Kaiser Permanente, and in California, and everybody pays a fee to be in the system, and then they get the care they need. And this is a very interesting concept of healthcare, and it seems to be quite successful. Of course, they do a lot of health education.
Well, and excuse me, I'm going to sneeze. Maybe I won't.
That's all right.
My understanding of a concierge system is that on top of the fee that you pay to be part of this practice, they are also then still billing for these services. And so that is where this is...
it's different.
This is way different. This is, you are not paying extra to get, to be honest, what I would call good health care, which is a doctor who is responsive and or someone in their office that they pay attention to you in terms of, they ask those questions, are you exercising, and what's getting in the way of your exercising, or are you... Those kinds of
it's
things.
my understanding though that you can always get a hold of somebody and talk to them, and this is good, I guess. And for some people who can afford it,
concierge system.
I suppose probably if they've had a doctor a long time and the doctor becomes concierge, what are you going to do? You probably want to stay with the doctor. And if you have the money, you can do it. But it's very important, all the work you've done, for people who don't have the money, and that's great stuff to do it for them.
Well, and the ACO is for everyone. I mean,
ACO?
The Accountable Care Act and the all-payer waiver.
Okay, all
As
right.
part of that, I apologize.
That's okay. Healthcare is full of little letters, and we all use them. Now, you mentioned earlier the drug and opioid problem, and this is really rampant in our state. One thing that's come out, the Vermont legislature requested, and the health department has proposed that when you leave a hospital setting or something like that, your first prescription for opioids is held down. And do you think this will cut down on addiction?
Kay, I think it's a very important step, and I want to say I'm the one who brought that bill to the floor of the House.
Good for you. Good for you.
And it is an issue that the Human Services Committee, along with actually the Judiciary Committee, has and other committees has sort of worked with. The issue being opiate. What folks may not realize is a vast majority of Vermonters who are addicted or having trouble with misuse of opioids started with prescriptions. Now, I'm not saying that all of those prescriptions were prescribed to them. They may have gotten them from the medicine cabinet of someone they know, or they may have stolen them. But when you leave a dentist or a doctor's office with 60 pills, you don't need to. And all this is trying to do, and the rulemaking process means that doctors and then perhaps patients or people who rely on opiates for pain relief have an opportunity and will have an opportunity to comment. This is part and parcel of one way of addressing one of the avenues of our opiate crisis. What I'm sure you know, Kay, because you're very knowledgeable, is that unfortunately Vermont is not alone. And in fact, some may say that Vermont has just made it very clear that this is a problem, that this is a problem that is a community problem.
Right.
It's not a law enforcement problem, it's not a drug and alcohol problem, it's not a health problem, it's not a family problem, it's not a personal problem. It is an issue for all of us.
Yeah. It is all of those things.
It's all of those things.
It really is all of those things.
It is all of those things, and so we need to, we need to continue because we haven't gotten a total handle on it. But we need to look at each one of those spokes or tentacles that is working together to maintain this.
Right now, it's just, you're a social worker, and it's just been a little over a year since Lara Sobel was killed in a parking lot in Barrie, I believe, and it was an issue of child custody. And I would like to have you talk a little bit, if you can. We don't have a lot of time, but just about what the state has been doing since then to assure that their employees are safe, and that social workers, particularly, their caseload. How are things going?
The legislature took this very, very seriously, and the Human Services Committee, along with the Judiciary Committee in the Senate, really sort of took the lead in looking at this. In fact, I'm chair of the Child Protection Oversight Committee. We believe this is so important an issue, not worker safety as well as protecting children, that we have an oversight committee during the summer and fall when the legislature is not in session. But circling back, what the legislature did was sort of again, there's no simple answer. We took sort of a three-prong approach. One, the Department of Children and Families was given the authority to hire more social workers for the purpose of reducing caseload size. We have a best practice, and research across the country suggests a caseload of maybe 15 per worker, and we don't have that. And every time we're about to get there, something else happens. But the new social workers being hired are taking a step in that direction. That's not, I mean, some districts it's very close to that, others
to the 15.
To the 15,
right?
And they're probably more close to 17.
Yeah.
But that's closer than it used to be. And there is something that we are all looking at in terms of, do you look at family? Do you count family as one? But when they have 6 kids, is that 1 or 6? So there are those issues.
Right.
But the purpose, the relationship of that to both child safety and worker safety is that if the people that you are working with, if your caseload is at a manageable level, then you're able to do your job fully, and you're able to form relationships with people and to maybe have a better assessment, to be able to assess the situation and know when you're going on a home visit when you need to be concerned and when you're not. So that was one piece.
Yeah. You have to move along here.
Right, sorry. And the other piece that we did was require not just the state, but also the agencies they contract with to put in place policies and procedures and protocols around worker safety. And finally, we put some money and a requirement, and that's in the development stage, in terms of both the physical plant, if you want to say, of the district offices, as well as being very thoughtful in terms of social workers having cell phones and having, for lack of a better term, sort of panic buttons when they, because their job is to be out in the field.
Right, right.
So we're working hard. I can't say we've reduced everyone's nervousness, but we're working hard.
Well, it sounds like you're working very hard, and you're listening to your committee members. And I thank you for coming. I know you have a busy schedule. Thanks for coming. Thanks for joining us in Conversations with Kay.